Embrace is the UK's first ever critical care transport service, transporting both neonatal and paediatric patients, and we cover the whole of the East Pennines area of the country from Scarborough down to Chesterfield. I chose Embrace to take my training that little step further. I've come from a critical care in both paediatric and neonatal background, and I've enjoyed being able to have extra responsibility in this team. There's plenty of training and support available, so you can get consultants on a phone easily, and when you start training, the consultants will come in the ambulance with you and be on scene. But as you develop, you're able to supervise transports on your own, so you become the medical lead for looking after very seriously ill children, which is a great way of developing a career towards consultancy. You get lots of training here. We have a consultant with an interest in simulation. There's over £40,000 worth of simulation equipment with fantastic dolls that breathe and turn blue, and you can intubate and ventilate and do procedures on them. But in addition, the consultants can come in the ambulance with you, particularly in the early stages of training, and will be with you on site. And then later you can work more independently with the consultants just in the background, available by phone. But you do get increasing independence and the ability to manage patients on your own. So a normal day will start off by doing some equipment checking. We need to make sure all our intensive care equipment is completely fit for purpose at all times. And then when a call comes through, we go right through the call handling process, taking medical information, facilitating discussion between experts, and then making a decision if we're actually going to go on a transfer. When we do actually go, we have to get our equipment quickly, designate a team, a particular ambulance, and then drive to the area. The sort of cases we deal with vary hugely, right from children who are 3 months too early to be born, all the way through to several 100-kilo 16-year-olds. You have to work extremely closely with your colleagues. One of the good things here is that we do have dedicated ambulances, ambulance staff and nurses. So we all train together, we all do simulation together, and we all work together extremely closely. So that means that we can think alike and work through situations much more quickly than in the conventional sense, where normally teams are just put together for a specific purpose.
Well, there's some great opportunities as a trainee doctor with Embrace. I think it's a really exciting, innovative service. And as the first of its type, we're looking to work with colleagues from abroad to learn from them. We hope very much to be organising rotations with the NETS service in New South Wales, and also discussing possible rotations with colleagues in Canada as well. So potentially there's that opportunity to broaden your horizons and look outside the UK for training. But within the UK, this is an opportunity to learn to work in diverse environments in different hospitals where they're resuscitating small babies or children in different areas, working with people that you've not met before and quickly learning to be a team leader in that situation. And I think that will stand people in good stead in their consultant careers in the future.
For more information about training opportunities with Embrace, contact Dr. Stephen Hancock on 0114 305 3006 or email stephen.hancock@sch.nhs.uk.